A little bit of background about me. I'm a physio who has worked with children with complex needs for a very long time. But I've been working at Very Special Kids Hospice since November 2017, and then more recently also at the Royal Children's Hospital as part of the Complex Care Hub. And the lovely thing about having these two roles now is that it's often the same children and young people and families I'm supporting, but I'm supporting them in hospice as well as at home and in the community. So I'm really enjoying that continuity. Before I go any further, I'd like to acknowledge the Aboriginal and Torres Strait Islander people as the first peoples and traditional owners, custodians of the lands and waters where we all are today. And I pay my respects to their elders and communities, for they hold the memories, the traditions, and the culture of all Aboriginal and Torres Strait Islander people across our nation. So to begin, just some, sorry, I've got all these faces. There we go. A definition that resonates with me about paediatric palliative care. I really like this because I think it encapsulates the very holistic approach for paediatric palliative care, and emphasises that it can begin from the very point of diagnosis and then continue on through a child's journey and then into bereavement for the rest of the family. And I think that's potentially quite different to adult palliative care. So an active and total approach to care from the point of diagnosis throughout a child's life, death, and beyond. It embraces physical, emotional, social, and spiritual elements and focuses on the enhancement of quality of life for the child or young person and support for the whole family. It includes the management of distressing symptoms, provision of short breaks, care at end of life, and bereavement support. Paediatric hospices are facilities that provide holistic care for children and young people with life-limiting conditions and their families, and that can be provided through respite, symptom management, step-down care, and end-of-life care. And paediatric hospices are staffed with multidisciplinary teams. Each of the hospices I visited would have sometimes a different makeup, I guess, of their team, but they had quite a selection of all of these, or a variety of these specialists on their teams. So medical specialists, nurses, personal care workers, a range of allied health professionals. So that was really interesting to see. In terms of physiotherapy, this is the definition that I particularly like, again, because it really emphasises that holistic focus for physio. And I guess if I give the context of how my Churchill Fellowship travel and study came about, despite having worked as a physio for many years with children and young people with complex disabilities, I felt quite isolated when I began working at Very Special Kids in 2017, because up until that point in time, there'd been no physio working in a paediatric hospice in Australia. And I quickly became aware of the depth of experience in hospices in the UK and Ireland in particular. And in the absence of any literature about physio and paediatric palliative care, particularly in hospices, I was eager to establish connections and learn more. At that time, too, Very Special Kids was planning to build a new hospice and having input from experienced physios, particularly around appropriate equipment, spaces that were really useful to have in hospices, and particularly hydrotherapy pools, because we have now got a hydrotherapy pool in our new hospice. It was really important for me to gather as much information as I possibly could to support the development of the new facility, which we have now. A benefit of the pandemic was the fact that face-to-face conferences, which these very dynamic, experienced, passionate physios had, became virtual. And so I was able to join their UK Hospice Physio Network, of which there's about 90 members, and to take part in their online conferences. The network's invaluable, and it became increasingly clear to me how useful it would be to visit these hospices and form strong connections with the physios working there. And it's really great to say that those connections continue to strengthen. And I just recently have had one of the physios who I visited in the UK come and spend some time with me at Very Special Kids. So our collaborative learning continues. Just for some facts and figures, I guess, about the contrast between hospices and paediatric palliative care in the UK as compared to Australia. a rough estimate of our population as compared to the UK, very different land sizes, and then enormously different numbers of paediatric hospices, with 54 in the UK and Ireland as compared to our 3, with our 4th opening in Perth at some stage this year. Very Special Kids was the first hospice to open in Australia in 1996. And that was partly the work of yet another Churchill Fellow, Sister Margaret Noon. And the United Kingdom had their first hospice open in 1982 with Helen and Douglas House. So of those 54 hospices, I chose a short list of 12, which was no mean feat to select. They were chosen primarily because of having really strong physio and allied health teams, and also being hospices that almost all had really strong aquatic physio programs as well. So now I'll just go through a very quick overview of the main sort of themes or areas of interest for me for developing a new physio service, I guess, in paediatric hospices in Very Special Kids, but also more broadly in Australia. So hospices with higher bed numbers and aquatic physio programs and outreach services equated to having the highest number of physio hours per week. And I started with 20 hours at Very Special Kids, but I'm very excited to say that in the last 2 months, we've employed a second physio. So now between us, we are able to offer over 50 hours of physio service per week. Hummingbird House in Brisbane has 2 part-time physios now. The Adolescent and Young Adult Hospice in Manly also has a part-time physio. Bear Cottage in Sydney is recruiting for another physio, and there will be a physio in the new team at Perth Children's Hospice when that opens. Having a 6 to 7 day physio service, it was very much the gold standard in the UK, and now that is something that we can offer at Very Special Kids. And it was interesting to see physios having leadership positions in many of the hospices through the UK as well. Respiratory physio is a big area of focus for us. Children and young people coming to hospice often have increasingly complex respiratory symptoms and airway clearance plans, which necessitates skilled physio input for assessment, intervention and training of other hospice team members. So there can be a range of different strategies we can use to manage respiratory symptoms, from positioning and encouraging activity and movement to using some more manual physio techniques, and then to using some more advanced technological equipment too, like cough assist and non-invasive ventilation. And physios play a really significant role, I think, too, in training the rest of the hospice team of nurses and carers around respiratory assessment and management of symptoms also. I've combined a lot into this side. So optimal positioning is recognised as being important for many reasons, both as a short-term means of managing pain, respiratory challenges and symptom relief, but also with a longer-term perspective for children and young people who may come to stay for respite. A significant number of children and young people with life-limiting conditions may live for many years, and some graduate from hospice when they reach 18. And for these children and young people, it's still really important to focus on the future and minimising deformities and contractures. Using postural support equipment is really important for them. A wide variety of equipment is used in hospices, so it's great to be able to see the things that people valued the most, I guess, over in the UK, and then to be able to have access for those types of equipment in our hospices here also. Again, we provide education to the broader hospice team so that when physios are not present in the hospice, these types of interventions can be carried out throughout the 24 hours, particularly important for positioning. And physios also offer lots of opportunity where we can for promoting active exercise, independent mobility and gross motor skill development, because I see if palliative care and those referrals happen really early in a child's journey, which is really, really important, then there are often times through a child's life where they might be learning new skills, developing improved strength, improved balance, participating in a wide range of activities. And then there are other times where things might become more difficult and they need additional support. So I think using our physio brains of really detailed analysis of where a child or young person is at, and then adjusting whether it's a time to provide the right challenge and development of new skills, or whether it's time to provide more support, with the ultimate goal of always ensuring that the child or young person is doing something that is meaningful and really important to them. Aquatic physio was definitely a big focus for my trip or my study, because with having a new hydrotherapy pool being built in our facility now, it was really important to gather as much information I could, so I could set up this program in the best way possible. And I have to say, I think it's probably one of the most popular facilities of our hospice of all. It takes a lot of resources and a lot of planning to make the sessions safe and appropriate, but the pool can be used for all sorts of things, from pain relief and symptom management. It can be a relaxation session. It can be focused on flexibility and mobility, or it can be a super dynamic, energetic session based on lots of activity and exercise and fun. Sometimes we have the whole family coming in the pool with us. Particularly if it's an end-of-life admission, the child can be there with their siblings and family all around us. Lots of opportunities for memory making, taking lots of photos and videos, and we sometimes have a music therapist in there as well. So it's a really important and effective way of providing support. I saw a lot of different equipment, lots of different floats and things that can be used, different ways of accessing pools. So that was, so valuable, having that experience to go and learn from the people who are doing this every day. We recently had our first child ever at Very Special Kids coming in the pool with a tracheostomy, and it required a lot of planning, but it was a really positive scenario, and that child had never previously been in a pool, so to be able to give her that experience was very special. And end-of-life care. So physios are definitely involved in providing support at end of life. So that can be around positioning for comfort, to decrease pain, to assist with management of respiratory symptoms. It's very much tailored on the needs of each individual child or young person at the time. And sometimes it can be as simple as supporting families with knowing how to change the position for their child, or perhaps doing some gentle stretching or gentle massage, anything that gives the family a way of feeling that they're involved and supporting their child to be as comfortable as they possibly can at that time. Physio is provided in a wide range of spaces in and outside the hospice, and wherever possible incorporated into the daily experience of the child or young person, with their needs and wishes at the heart of this. Offering choice, taking the time to build rapport and connection with each child or young person is fundamental to paediatric hospice care. I've got gym mentioned there. That stuck in my mind quite significantly, because one hospice I went to in Rainbow's Hospice in Loughborough has a gym, and that was used quite often for children who were not staying in the hospice, but it was a way of them coming in and having an experience, doing some exercise, building connections with the physios, becoming familiar with the environment, so that then perhaps that might have been a gradual introduction to them maybe coming to hospice for respite, or maybe it became a safer, sort of more familiar option for end-of-life care. We've started to find that we've been using our hydrotherapy pool like that too for some children, where they will just come in and have a session in the pool, or maybe it's a session with the child life therapist or a music therapist, just making demystifying what hospice is, and building connection and relationships with the children and young people and their families before they consider respite or end-of-life care. Just a couple of thoughts about physio and childhood dementia. I guess lots of these principles apply for children with any sort of life-limiting condition, but also relevant for children with childhood dementia diagnoses. So, like I talked about before, being able to provide support for development of gross motor skills, physical activity and mobility and independence, working on strength, balance and coordination, as really I guess, positive kind of input into a child's development. Physios are also very important in building the relationships and connection and familiarity with hospice. And then if things are becoming more challenging, then we're also very involved in providing recommendations on use of equipment and increasing levels of support, with the focus always being on participation in meaningful activities for the child or young person. So they're doing the things that really matter to them. And as well as management of any distressing symptoms, if we can provide more comfort, then that's always a high priority. Overall, these are some of the guiding principles, I guess, of paediatric hospice care. So having that bigger picture view from the United Nations Convention on the Rights of the Child, where all children and young people have the right to live a full and happy life, develop healthily, and to have a say in what happens to them and to have their opinions taken into account. Remembering the right for all children to play, and that children with a disability should receive special care and support so they can live a life that's full and as independent as possible. I often think about the F words of childhood disability too. I'm not sure if people in this group are familiar with that, but they really resonate. And I think it's not just about children with disability, it's relevant to children with life-limiting conditions as well. So thinking about function, thinking about family, fitness, fun, friends, and future, all of those F words are really important in really framing what we're doing and how we're best supporting children. Spoken a few times about it, with that parallel need for supportive palliative care as well as active treatment, development and learning. So it's a beautiful balancing act, I think, of really understanding where a child's at and providing the right support at the right time. And of course, child and young person centered care. So just some acknowledgements to finish. I'm always grateful to the Winston Churchill Trust and Dr. Dorothea Sanders and Irene Lee for their ongoing legacy of fellowships in palliative care. I can't recommend Churchill Fellowships enough for being incredible opportunities, and the connections that you make continue on, and the project, I feel like it never finishes, and I think that's a good thing. I also, of course, acknowledge very special kids, professional colleagues, and particularly the children and young people and their families, who are always the greatest teachers, and then the physios and many other health professionals I met during my travels.